Welcome and greetings from Manipal. Myself, Dr. Chandrika Nayak from Manipal Academy of Higher Education. I am here to give you some inputs on the topic vitamin D. Let's go through its metabolism with a biochemical approach. So let's define the learning goals first. So we are here to study about the metabolism of vitamin D. So what are the headings under which we will be trying to cover them? So we'll try to understand the chemical forms of vitamin D, its sources, RDA, then we move on to the biochemical functions. After that, biosynthesis, activation, regulation, and finally about the vitamin, its deficiency symptoms, toxicity symptoms, and maybe at the end one or two questions just to revise the topic once again. So let's begin the discussion on this vitamin. Vitamin D is a fat soluble vitamin. You all know that vitamins are divided into two groups, the water soluble vitamins and the fat soluble vitamins. The fat soluble vitamins are four: vitamin A, D, E and K. And today's topic is vitamin D. It's a fat soluble vitamin. Definitely it means it has a structure that makes it soluble in fats. So what's the structure? As you can see, it's belonging to a group of sterol. It has a sterol ring structure. And that's the reason why its mechanism of action is comparable to that of a steroid hormone. As we go through the topic, you will understand how it is able to do the function just like a steroid hormone, the mechanism of action. So what are the different chemical forms of vitamin D? We have vitamin D2, which is coming from the plants. It's called the ergocalciferol. D3, which is derived from animal sources. It's called cholecalciferol. Now this vitamin D, if it has to perform the functions inside the body, it should first be activated. What is the activated version of vitamin D called? You can see here the activated version of vitamin D is called as 1,25 dihydroxycholecalciferol or calcitriol in simple words. This vitamin is also called as the sunshine vitamin. We all know that we can get our vitamin D source by just exposing ourselves to the sunshine. Of course, northern and western countries or people living in the northern latitudes of the globe will get little lesser sunlight and maybe their exposure will be less. You also have to remember that we need the UV fraction of the sunlight. How much is it in nanometers? It's approximately 290 to 315 nanometers. So which is the part of the skin which should get exposed to this UV fraction to make the vitamin D? That portion is the dermis and the epidermis of the skin, or it's also called as the stratum corneum of the skin. What's the precursor from where you can actually make vitamin D? The precursor is called 7-dehydrocholesterol. It's actually an intermediate in the cholesterol biosynthesis pathway. From this 7-dehydrocholesterol, we try to build up the vitamin D first by exposing ourselves to the sunlight. Of course, people with dark skin will have higher amount of melanin which can actually interfere with the vitamin D synthesis. So let's move on to the sources. Having said so much that it's a sunshine vitamin, by now you already have registered under your mind that it can be made by us by exposing ourselves to the sunlight. But in addition to this, what are the sources? So if you are a non-vegetarian, the sources could be fish, liver, egg yolk. Endogenously, we can make it from 7-dehydrocholesterol and that should start from the skin. Why am I repeatedly saying start from the skin? Because the first step is in the skin, the next step is in the liver and the final step is in the kidneys and you get the functional calcitriol to do the actions. What's the RDA? All of you know what do you mean by RDA, recommended dietary allowance, right? For children, it's higher. They are in a growing period. Bones are growing. Calcium requirement is more. You all know that vitamin D is important for calcium homeostasis. So, children will need about 400 international units per day, whereas adults it's relatively less, bones have been fully formed, so it's about 200 international units. Of course, when there's pregnancy and lactation, definitely women will have to increase their requirement, and that will again come up to 400 international units per day. So, that was the RDA and the sources. Coming to the most important part of this topic under metabolism of vitamin D. Vitamin D is a hypercalcemic hormone. You call it a vitamin, but at the same time its action is like a hormone. So, that is why we call it as a hypercalcemic hormone. What do you mean by hypercalcemic hormone? It's involved in the calcium homeostasis, and it tries to increase the blood calcium level whenever it drops. So, to do the action, vitamin D in its active form should act on the bone, the intestine and the kidney. To act on these three tissues to increase the blood calcium level, it first has to be in an active form. So, now we will study activation of this vitamin D. We already told you that the synthesis or activation begins from the skin. You can see in the slide here, the starting material precursor is 7-dehydrocholesterol. When the UV fraction of the sunlight falls on the skin, 7-dehydrocholesterol can easily be converted to cholecalciferol. This is vitamin D3. You can obtain this vitamin D3 by eating sources which fetch you vitamin D3. So, it can come from the dietary sources also. So, cholecalciferol has been formed. It moves through the blood, and from the blood it enters the liver. So, comes the second step of activation, which happens in the liver. So, in the liver there is an enzyme called as 25-alpha hydroxylase. 25-alpha hydroxylase now tries to activate vitamin D3 or cholecalciferol to 25-hydroxycholecalciferol. After this, it moves to the kidneys. Then comes the most important, the regulatory step of the activation process, and that's brought about by the enzyme 1-alpha hydroxylase. Both these enzymes, hydroxylases, definitely require cytochrome P450. And the final product or the active form of vitamin D is ready. What's the name of the active form? You can call it calcitriol, or 2 hydroxyl groups have been added at the first position, 25th position. What's the name of calcitriol? In other words, it's called 1,25-dihydroxycholecalciferol. So, this is about the biosynthesis and the activation. So, in this slide, you can see that the calcitriol is ready. This is called the active form of vitamin D. Now, there are situations when blood calcium will increase, there are situations when blood calcium falls. We need to have some regulation, or in other words, calcium homeostasis. So, this happens with the help of the important organ, kidney. So, in the kidney, just a while ago we saw that the last step or the important step is that catalyzed by 1-alpha hydroxylase. So, you just saw this step and you came to know 1-alpha hydroxylase is the chief regulatory enzyme of the biosynthesis of active form or calcitriol synthesis. Now, when calcitriol levels are high, it's a hypercalcemic hormone, it will increase the blood calcium level. So, when the calcium levels have come up to the normal levels, we don't need calcitriol to act. So, what happens in the body? There is a feedback mechanism. Check the slide. There is a feedback mechanism. When calcitriol levels have risen, calcium levels have increased and come to normal, it sends a signal to 1-alpha hydroxylase to stop its action so that there is homeostasis. Now, if calcium levels go on increasing, which is very high, You don't want actually calcitriol. So look at this reaction. When serum calcium levels are extremely high within the kidney, another enzyme is activated. The name of the enzyme is 24 alpha hydroxylase, and this 24 alpha hydroxylase tries to deactivate calcitriol. The deactivated version is called calcitroic acid. This is brought about by the help of an enzyme called 24 alpha hydroxylase. So that's about how when the calcium levels go high, you try to stop calcitriol synthesis and stop rising the calcium level. Now what happens if there is a fall in calcium levels? When there is a fall in calcium level, low serum calcium, that time the PTH is secreted. Parathyroid hormone senses it and is released into the blood. PTH immediately sends a signal to 1-alpha hydroxylase, stimulates it and increases calcitriol synthesis. So you can see here, when the calcitriol synthesis increases, you can bring the calcium levels back to normal in the blood. Similarly, when there is a drop in phosphate also, there is a direct stimulation of 1-alpha hydroxylase. So let me repeat two important things. Low serum calcium indirectly stimulates calcitriol synthesis through PTH, whereas low phosphate level directly stimulates 1-alpha hydroxylase and increases the calcitriol synthesis. So this is called as regulation of calcitriol synthesis in the kidney. Let's move on to the action. I always say this, calcitriol action is on 3 organs. It's a 3-point action. Action on bone, intestine and kidney. So let's begin with the first tissue on which it acts. Calcitriol, even though it's an activated vitamin, look at its action, it's going to mimic that of a hormone, somewhat like a steroid hormone. So that's why let's study the actions on bone, intestine and kidney. Starting with bone. Let's assume a person's plasma calcium level has dropped. It has gone low. What to do? Bone is the reservoir of calcium. You need to get the calcium out of the bone so that blood calcium is maintained. We all know that when blood calcium falls, there are so many complications. We don't want that. So that's why vitamin D or calcitriol in its active form tries to increase bone resorption. What do you mean by bone resorption? That is, you are trying to break down the bone and get the calcium out. So PTH and calcitriol both are involved. They will act on the pro-osteoclast, convert it to mature osteoclast, favor bone resorption, favor demineralization. Demineralization means breaking off of calcium and phosphate and releasing them into the blood. So you are bringing the calcium levels back to normal. Let's assume plasma calcium is high. Plasma calcium is high, you do not want any more release of calcium into the blood. So there is bone mineralization. What does vitamin D do? When calcium levels are high, it makes calcium and phosphate undergo deposition as hydroxyapatite and it deposits in the bone matrix in the osteoids. So when the calcium is low, bone resorption. When calcium is high, bone mineralization. This is the action of vitamin D on bone. Moving on to the second one, that is action of calcitriol on intestine. Here we have a picture, an intestinal mucosal cell. I have repeatedly told you that vitamin D behaves like a steroid hormone, right? So let's assume the vitamin D or calcitriol is ready. It can easily cross the cell membrane of the intestinal mucosal cell. It comes into the cytoplasm of the mucosal cell. There is a receptor, cytosolic receptor waiting there for this calcitriol which is behaving like a hormone. They form a complex, we call it calcitriol receptor complex. Once this complex is formed, it starts moving into the nucleus of the mucosal cell. And in the nucleus, there is a particular gene where it will go and bind and increase the mRNA synthesis and finally translation, and there is production of a protein called as calbindin. Calbindin is a protein which sequesters the calcium. So, calbindin, as you can see in the picture, tries to bring in the dietary calcium. Whatever calcium we have consumed in the diet, calbindin will try to suction it into the cell, and from the cell you can see in the picture towards the blood. So, this is called as calcitriol action on the intestine. If you look at these stages or steps here, you will clearly understand that calcitriol is behaving like a steroid hormone. It first came into the cytoplasm, bound to the receptor, then moved into the nucleus and brought about the action. So, action is similar to steroid hormone. So, this is the second organ on which it acts. Just a while ago, we saw the action on bone. Now, we saw the action on intestine. I told you 3-point action. So, it's time to see the third one, and that's the action on kidney. So, calcitriol action on kidney. Kidneys, we know they are meant to filter out the excretory waste, but at the same time, it does not allow any important compounds to be sent out through the urine. Same applies here. We don't want calcium and phosphate to be lost in the urine. So, what is the action of vitamin D? Vitamin D tries to reabsorb calcium and phosphate. It promotes the reabsorption in the distal convoluted tubules. It also promotes the synthesis of calbindin and certain calcium transporters, and with the help of both these, it will try to reabsorb calcium back into the blood. So, these are the actions on bone, intestine and kidney, and all the three we saw, it tries to increase the calcium level. That means it is a hypercalcemic hormone. So, this was about the synthesis, activation and biochemical functions. So, let us try to learn something about vitamin D deficiency. What happens if we have deficiency of vitamin D? There are two categories how you can divide it based on the age group. If there is deficiency in the children, we will call it as rickets, that is before the closure of the epiphysis of the bone. But if the epiphysis has closed, that is deficiency is in the adults, you will call it as osteomalacia. So, what are the reasons or causes for rickets? There are many causes. We will divide them into 4 main headings: nutritional rickets, renal rickets, then we have vitamin D dependent rickets type 1 and type 2, and then hypophosphatemic rickets. And as I told you, if the age group, that is happens in the adults, there can be what is called as osteomalacia. So, I repeat, vitamin D deficiency in children is called rickets, D deficiency in adults is called osteomalacia. So, let us start studying with rickets. What is the first type called? It is called nutritional rickets. Simple to understand. That means the child or the infant or the newborn is not able to get proper vitamin D. This happens in exclusively breastfed infants. Mother's vitamin D levels are already low and she is only breastfeeding it exclusively. So, no fortification and things like that. So, there is no vitamin supplementation. This can be a trigger for developing rickets. So, this is called as nutritional rickets. The second one, the name itself tells you, renal rickets. And just a while ago in the previous slides, we have seen that the role of kidney in the calcitriol synthesis. So, if something goes wrong with the kidneys, then definitely what can happen is rickets can develop. So, if there is conditions like renal tubular acidosis, then there can be resulting of rickets, and chronic kidney failure, kidney is damaged, kidney is not able to make calcitriol, then definitely you will have to put such infants or children on vitamin D analogues and calcium supplements. What do you mean by vitamin D dependent rickets? There are two types, type 1 and type 2. Type 1, the person in his kidney by birth, that is genetic defect, does not have this enzyme 1-alpha hydroxylase. So, definitely he will be unable to make calcitriol. So, what happens is they will grow up with low serum calcium, low phosphate levels, elevated ALP levels, and despite hypocalcemia, calcitriol synthesis cannot be triggered. It will not happen because the kidneys do not have 1-alpha hydroxylase. What do you mean by type 2? Calcitriol synthesis is normal. Calcitriol levels are normal in the blood, but there is resistance. So, it is not able to act on bone, kidney, intestine. So, in spite of having calcitriol, it cannot trigger the actions. So, definitely there will be hypocalcemia, due to which there can be secondary hyperparathyroidism. Elevated calcitriol levels will be there, but calcium and phosphate levels will continue to be low. This is because there is resistance to calcitriol action on the tissue level. What do you mean by hypophosphatemic rickets? Hypophosphatemic rickets means, let us give the example, there is impaired proximal tubular reabsorption of phosphate and there will be hypophosphatemia. When I showed you the picture of regulation of calcitriol synthesis, I told you when there is low phosphate, there is direct stimulation of 1-alpha hydroxylase. So, here in this case, there is hypophosphatemia, and due to this hypophosphatemia, there is no proper stimulation of 1-alpha hydroxylase. So, renal 1-alpha hydroxylase does not get a good stimulus or a good activation stimulus, and due to which calcitriol synthesis will be affected, calcitriol levels will be low, and due to that there is rickets. So, such a type of rickets is called as hypophosphatemic rickets. And of course, we are going to study the symptoms and the findings, and here also in such a type of rickets there will be genu varum, genu valgum and short stature. What each means we will come to know in the next few slides. What are the other causes of rickets? If there is something that is disturbing the GI tract like steatorrhea, malabsorption syndrome, so you will not be able to absorb the dietary vitamin D, and definitely it will lead to rickets. And chronic liver diseases also, bile salts will not be produced properly. If bile salts are not there, there will not be fat absorption, there will not be vitamin D absorption. So, definitely vitamin D deficiency, and that can lead to rickets. So, these are other causes which can lead to rickets. So, this was about vitamin D deficiency in children. It is called as rickets. There were 4 types of rickets we discussed: nutritional, renal rickets, vitamin D dependent type of rickets type 1 and type 2, and hypophosphatemic rickets. So, let us move ahead. What happens if there is vitamin D deficiency in adults? This is called as osteomalacia. What are the causes? It could be like adults are working indoors away from sunlight all the time. They are using strong sunscreen when they are going out. So, definitely UV fraction will not fall on the skin. There could be dark skin, too much melanin, so melanin obstructs vitamin D synthesis, or they might be living in northern latitudes of the globe where there is very little sunlight duration, or certain GI diseases also, due to which vitamin D absorption can be affected. And if they are strict vegans, as we call them, they are vegetarians and do not take any milk products, definitely they are bound to develop vitamin D deficiency. What are the features of osteomalacia? So, if a person has osteomalacia, his bone will tend to fracture. There need not be actually a very bad injury. Without any bad injury or a real injury, the bone can crack. There will be muscle weakness, there can be numbness, tingling in the feet or in the hands, there can be spasms, cramps of the hand and the feet, bone pain, especially in the hips. So, these are all the features of what is called as osteomalacia. So, let us quickly recap or understand why certain features come in rickets. This is happening when the bone fusion or epiphyseal fusion has not taken place. So, it could be an infant, a toddler or small children. Vitamin D deficiency, Plasma calcium and phosphate levels are dropping because there is no vitamin D. There is continuous formation of collagen matrix happening because it is a bowing grown. Collagen is there, but calcium and phosphate is not depositing. What happens to the quality of the bone? The bone becomes very soft. We call them soft pliable bones. And when there is incomplete mineralization in the soft pliable bones, there will be swelling, pain at the ends, at the epiphyseal, metaphyseal region, in the wrist, ankle or sternal end of the ribs, and this is the reason we see the typical clinical findings of rickets. In the next few slides, we will try to see some pictures of children having rickets, the bone changes or the radiological changes in the bone. In osteomalacia, it is slightly different because bone has already grown, epiphysis has already fused. So, what happens if there is vitamin D deficiency, calcium and phosphate is continuously being lost out of the bone is having less calcium, less phosphate, and so the tendency to fracture is more. So, there is brittle bones. In rickets, it was soft pliable bones. In osteomalacia, adult bones, it is susceptible to fractures because it has become a brittle bone. So, now let us see the clinical findings. We call it as the skeletal deformities seen. We will see the deformities in the head, thorax, arms and feet. Let us begin with the thorax first. You can see two pictures here. The first one is the pigeon chest and the second one is a rachitic rosary. So, in the pigeon chest, as you can see, it is caused by the weakened bones. Okay. So, there is a sort of pull created by the respiratory muscles. The ribs are already very weak and the sternum tries to project forward. So, in the first picture which is shown as pigeon chest, you can see the sternum is projecting forwards and this is because of the weakened ribs and also the muscles creating an inward pull. Rachitic rosary, as you can see in the second picture, the costochondral ends we call that, there is swelling. So, it looks like a rosary. All of us know what is a rosary which they use to meditate, right. So, it is a beads containing chain. So, if you look at the rib line, you can clearly see in the picture that there are swellings at the costochondral junctions. So, this is called as rickety rosary or rachitic rosary. And then comes the Harrison's sulcus. So, Harrison's sulcus is actually caused by pulling of the ribs that happens during inspiration. The pull is created by the diaphragm. So, you can see that there is a depression above the subcostal margin at the diaphragm level. These are typical findings of the rickets. Look at both the pictures, there is bending at the knee level. So, the first one is called knock knees. The knees and from there the legs, they are moving away and that is called as knock knees, or a medical term for that is genu valgum, and you can see bow legs, the two legs, they are bending inwards and that is called as genu varum. Now, why does this happen in children? Because the bones are soft and pliable. There is vitamin D deficiency, calcium is less and it is a soft bone, and when they try to walk, the entire body weight falls on the legs and so the bones can't take the pressure. So, the bones bend. They do not crack, but they bend, and that is how you see the bow legs or the knock knees. And you can see this picture here, it is radiological imaging of the bones in the hand, and you can see that when the metaphysis, what has happened, there is less calcification at the metaphysis, and because of this there is a problem in the growth plate area. So, it gets a frayed margin appearance, and you can also see that due to repeated stress falling on such bones, there will be splaying and cupping of the metaphysis. And the second picture is the frontal bossing. The bone is very soft and the brain is growing and the pressure is created. So, you see the bossing appearance. You also see from the anterior, from the superior view, when you see the scalp area, you can actually see what is called as caput quadratum. It's like 4 buns there, okay. So craniotips or the ping pong ball sensation. So that was about rickets and also about the osteomalacia in adults. So it's time to know very little about hypervitaminosis. See, remember, fat soluble vitamins like vitamin D, it's a fat soluble vitamin. It can be stored in the body. In fact, it's stored in the liver. So, if you consume vitamin D excessively, this happens in people who go on taking vitamin D supplements without monitoring the blood vitamin D levels. That time there can be toxicity, which is dangerous because there is too much accumulation in the liver. So, remember always, vitamin D can be stored in liver. So, definitely there can be toxicity symptoms if you take very high levels of vitamin D every day for weeks and months. You go on taking vitamin D, it's not good. So, what are the features of hypervitaminosis or toxicity of vitamin D? The person can slowly develop appetite loss, can develop nausea, thirst and weakness. It might go without his knowledge. He may not be thinking it is due to vitamin D, but due to vitamin D excess or taking too much, he has developed these symptoms. There can be hypercalcemia also. Calcium can deposit. Where can it deposit? Calcium can deposit in the soft tissues because high calcium levels are prevailing, and there can be metastatic calcification, or it might go and deposit in the arteries, and that can cause calcinosis. So, these are the problems when there is vitamin D toxicity or hypervitaminosis D. So, let us quickly try to revise the topic with few questions. The first question, which among the following tissues or organ is involved in calcitriol inactivation? Please be careful, not activation, inactivation. We just told you it's the third option, that is kidney, because in kidney we have an enzyme called as 24 alpha hydroxylase, right? Now, this is the one which can inactivate. So, it's kidney. What's the second question? Which among the following enzymes is activated by PTH to promote calcitriol synthesis? In that picture where I showed you kidney and the regulation of vitamin D or calcitriol synthesis, I clearly told you there is an enzyme called as 1-alpha hydroxylase. So, it is the first option. 1-alpha hydroxylase is the enzyme that is activated by PTH to promote calcitriol synthesis. So, that is about the inputs on vitamin D, the sunshine vitamin or the activated version, which is called as calcitriol. So, always remember, it is a fat soluble vitamin. You can get it easily by exposing yourself to sunshine. Once it is ready as calcitriol, it has 3-point action. It acts on the bone, intestine and kidney. It is a hypercalcemic hormone. It means it tries to increase the blood calcium level. If it's deficient in the children, it's rickets. If it's deficient in the adults, it's called osteomalacia. So, that was about vitamin D. So, thank you very much.